Well, with me is a member from the West Midlands Quality Review Service, Jane, who was with us just a few months ago. When you first sort of landed, we literally got you, didn't we, before you did anything. You did that visit, which was only a day. You come back now for another single day on the stand.
That's right.
So it seems like you've got to do an awful lot in such a little time, but you've been managing to talk to the staff this time, I understand.
Well, we talked to the staff the last time we were here in September as well. We've just done another staff briefing. The other thing we're doing today is meeting with the staff in the services who are being reviewed. So we did that in September, we're doing it again now, and that's specifically to plan the visit in detail with them.
What can you tell me about what you tell the staff then today? What is out there in the public domain?
What I talked about was what we think that the West Midlands Quality Review Service can offer for the Isle of Man's health services, a bit about why we think it's a good offer for you. And then I answered a number of questions from them about the reviews and how they'd be conducted, that sort of thing. Timescale for production of reports, a range of different questions from them.
Have you got any sense of morale, for instance, in your visit so far? If it's good, bad, indifferent, what?
I haven't got any sense at all.
But will you find that out? Is that part of it at all? Or you just simply going to... I know it's serious illness, for instance, is your first review. Do the staff not have any effect on this, when you look at this? We'll
meet with the staff, we'll talk to them about the services, we'll look at the quality of the services that are provided. Now, against specific standards. Now, staff morale is quite a difficult thing to measure. Yeah, I would say, though, if the reviewers were really concerned about staff morale, they would put something about that in the report. But it might be something for further consideration. There might be something in a report about staff wellbeing, I don't know. But if the reviewers are worried about it, then they will include it.
So this is all pre-stuff still. Next time you actually get down to business, but again, is it just a day that you come in here for, or will it be a longer period of time?
No, we review a number of linked pathways on a single day. So the review we're doing in November is of the emergency department, theatres and anaesthetic services, and critical care. And those are the linked services that we're looking at on the next visit. You might say, how can you do that in a day?
Well, yes.
Well, we bring a team of reviewers, so they're reviewing in parallel streams. Some of the reviewers look across all three. We have a lot of experience of reviewing services in a day. And we believe that it's a way which, as long as everybody works together, produces a good review, but with minimal impact on clinical time. Because what we don't want to do is take time away from seeing patients, either of your staff on the Isle of Man or of our reviewers, so we minimise the impact on clinical time.
Isn't it the danger, though, this is the conspiracy theorists, of course, will be saying this, that they know exactly what you're going to be looking at, what days you're going to be looking at it, so everything will be absolutely polished up and presented to you in a very, very nice way, which is maybe not if you just came in on a random basis or without any notice to have a look at things. Does that worry you at all that this is so planned?
Right. Two answers to that. One is, what we bring are peers. So we bring patients and carers as well, but we bring peers. They're consultants, nurses, variety of disciplines who are working in a similar setting. You cannot bring peers from somewhere else without giving notice. They have to give 2 months' notice to their employers that they're going to come away. So you can't do that unannounced. If you want the benefits of peer review, it needs to be announced. The other thing is, what it tells you about is what people think is good. And if they know that something is good, that's half the battle. We were reviewing a service a few months ago now, and we asked to see case notes. So the reviewers looked at some case notes for specific questions. Now, if we were coming to see your service, you'd probably get out the best case notes and you'd check them beforehand. The case notes were brought out and there were a number of different problems with them. And you think, why didn't they check them? Because they didn't know what was good. So it tells you, if they know what's good and they can show you that, that is half the battle, even if they're not achieving it. Ideally, you do unannounced visits as well. That isn't within the scope of what we can do if we're going to use peers. The advantages of bringing people who really know what it's like to provide that service is, I think, a real advantage.
You've done this elsewhere, so any ideas yet of how the Isle of Man system is looking in general yet, or is it too early to even say things like that?
Too early to say.
Are you hopeful, though, you'll give confidence back to everyone about the health service in the Isle of Man?
Yes. Our reviews provide a robust assessment against a set of standards, explicit standards, and the approach that we have, the multidisciplinary approach, the teams work together, we check out the report, we sign off the report, that will give a robust assessment against those standards.
Well, lots of people looked at our video, and you're back here again today, so this is quite good. It appears that it's in the public domain. And will you be available throughout this process to talk to us again?
Be happy to talk to you. The only thing is that our review visit days are incredibly busy, so we probably won't be able to talk to you in the middle of a review visit.
And this is at least a year, isn't it? You'll be doing this.
The intention is a programme over 3 years.
And we'll have chances, therefore, at some point to catch up again and review your review.
Yes, with pleasure.